Hello, I am Nick. I was talking to you about systemic fungal infection and candida, um, and the paradox that can happen with candida being a protective something that protects our cells from further damage and death, maybe because they attach with the heavy metals and other toxins, and with that way, even though they infect us and they produce more biotoxins, they at the same time protects our cells. Okay, so as far as other treatments for the yeast and also for the parasites, colonics is an option. I think that it can be beneficial, but you have to be careful, because every time you do a procedure like this, you kill off together with parasites and yeasts, you can kill off your friendly gut flora and friendly bacteria. It's an invasive procedure in general, so that's why you should be careful and take your probiotics after. You should do it with a program, I mean. And as far as probiotics, I suggest that we should all take bifidobacteria, which is a form, and it has many strains that produce lactic acid, and it helps to cool down the inflammation, cool off the inflammation, and to repair the gut lining and make the environment acidic in the colon, in order to make the environment unfriendly for the yeasts and the parasites. As far as lactobacillus, I suggest that you should avoid acidophilus. You can check my other video that I'm referring to the gut. The work of Dr. Kelly Demerlier is very important for me, in my point of view. Many of us, we have many D-lactic acid, potent D-lactic acid producing bacteria like Streptococcus, for example, and by putting another bacteria like acidophilus in the game that can produce large amounts of D-lactic acid, it is a toxin for the microbes, but it also is a toxin for our bodies, and we cannot handle that, and it can create a lot of symptoms. That's why I am suggesting Lactobacillus salivarius, which is a form of lactobacillus that doesn't produce D-lactate. It only produces L-lactic acid, and that's the strain that I take personally. And of course, I take sometimes, because it is expensive, I take E. coli, friendly E. coli mutaflor, which is another very beneficial probiotic. But this has to do with the small intestine. Just remember that the parasites and the yeasts, they can be systemic, so you can have parasites, for example, in the small intestine. You can have parasites in many organs, and together the same happens with the yeast. Another thing that is important is, of course, to try and have a diet with low glycemic load. Try to avoid all sugars, starches, alcohol, and simple carbohydrates in general. I do that 3.5 years now that I am sick, almost 4. I do that. I don't eat simple carbohydrates, and I have a constant struggle with the yeast, because, as I told you before, I have severe hypochlorhydria, and this makes my battle with the yeast more difficult. But I think that I'm making progress, and lastly, I am supplementing with niacinamide, which is a form of niacin, of vitamin B3, and many studies has shown that it can help you with your insulin levels. It can help with insulin resistance, and that's why Dr. Klinghardt uses it. with his patients, but it can also have multiple benefits because it is potent antimicrobial and antifungal. It has some properties that just make the bacteria and the yeasts to proliferate with a slower rate, and that can help with the battle by reducing the load of the bugs in our bodies. Now another thing is that many herbs from the Cowden protocol, for example, that I follow, and in general in the market and in the net, you can find a lot of herbs that have antifungal or antibacterial activity. I think that something which is very important is that we should all check for a specific genotype that we can have, and Dr. Richie Shoemaker's work is very important, and I think in the years that will come, more and more focus will be placed there. There are many people that can have specific HLA genotypes which make them unable to detoxify the toxins from the yeasts, from the mold, and from the Lyme bacteria and the co-infection bacteria. And even though if some people, for example, have reduced the load enough, they can still feel extremely ill because they are unable to detoxify from the toxins and the biotoxins that the bacteria are producing while they're dying. So it's very important to check that, to check if you have a susceptibility to biotoxin illness, and Dr. Richie Shoemaker has named the illness CIRS, which stands for Chronic Inflammatory Response Syndrome. I think that all these illnesses, you know, there is an umbrella term that is called chronic fatigue syndrome, and all the other names are illnesses that are under this umbrella term. Another treatment for the yeast and also for the bacteria that is very important is oxygen treatment, and with ozone or hydrogen peroxide or other stuff like MMS, which is sodium chloride. You know, oxygen kills bacteria. Our natural killer cells, they produce hydrogen peroxide to kill bacteria, yeasts, parasites, and all the bugs. So by increasing the amount of oxygen with ozone or in other form, you increase the defense of our immune system in general. So you can reduce the total load. And candida is a bug that can be killed by oxygen, and the same happens with the bacteria. Okay, let's move on now to the bacteria, which I think most of you consider the most important thing, the bacterial infections from Lyme and from Bartonella and the other co-infections and intracellular infections that we all have. Well, as I told you, oxygen therapy is a very good alternative therapy. I am trying to do ozone IVs, and I am drinking ozonated water. I think it is somehow helpful. Of course, it is helpful. It is helpful in another way, because by oxygenating the body, you increase the ATP. Because the problem of our ATP production, as I mentioned in another video, it has to do with oxygen delivery, and After every ozone treatment I feel better as far as energy, but I can feel the die-off Herxheimer reactions, so it is somehow balanced, you know, from that. There are many approaches. I think most patients prefer, and doctors prefer, to use the standard antibiotic or a combination of antibiotic treatments with IVs or oral antibiotics or injections sometimes. In my point of view, I don't know. I haven't tried taking antibiotics for the Lyme and the Bartonella and the Mycoplasma that I have, but I don't know. I think that if you are susceptible to the yeast and you have systemic candida, I don't know, it can make the condition worse. Of course, you should know that the bacteria become they create resistance, and of course they create biofilms and they change forms. So it is important to work together with a specialist. So I haven't tried that because here in Greece we don't have Lyme specialists, and I haven't decided yet. I don't have the money to visit Lyme specialists abroad. I don't know if I will try antibiotics sometimes in the future. Maybe, maybe not. As from now, I am following the Cowden protocol, which has helped me mildly, as I can understand, but I have an improvement in general with this protocol and with other things that I do. There is also other approaches like the Banner protocol, like Dr. Klinkhardt cocktails with ozonides and other herbs, liposomal herbs. There is the sea salt protocol, which is another famous protocol. I don't know, I haven't tried that. I don't know how effective it works, but it seems to be a good antiparasitic as well. It works osmotically. Ozone saunas, there are patients in the net that consider even full remission of symptoms with only with doing ozone saunas. Perhaps the ozone penetrates the body from the skin, and that's how it can kill the bacteria and reduce the total load of the microbes. I don't know. I think that it is something that might work. Perhaps I haven't tried that. And another thing that it is important as far as these intracellular bacteria that we have, and Lyme disease, Borrelia infection, these infections they change forms. A lot of times they change forms, so and they create biofilms. So it is very, very important to try and use something to break up the biofilms, like EDTA, for example, or Dr. Cowden suggests serrapeptase, which is an enzyme in his protocol. Other doctors might suggest heparin or something other, or another approach. The biofilm is a way that the bacteria use to protect themselves from the drugs or from the herbs that we use, and it is very important to address that, because you will need 100 times more antibacterials in order to reduce the population without addressing the biofilms. Okay, 15 minutes again. I will continue to with the next video about chronic infections, with a third video about that issue, which is, I think, it's central. Okay.